Let's get you over to Erica.
All right, Raul, thank you. It's a procedure that's being used to help people sculpt their stomachs and also to slim that muffin top. And now it's being used on your thighs. The FDA has actually just approved the use of this on your thighs. So the stomach thing is called CoolSculpt. The thigh portion of it is Cool Smooth, right?
Right.
And joining us this morning is Dr. Billy Groff to talk a little bit about this new procedure for your thighs, at least, right?
Sure.
Kind of tricky, kind of confusing. Why does the FDA do different approvals for different body parts? You would think if it's safe for your stomach, it's safe for other body parts.
Well, this handpiece is unique because if you think about the hips, the fat there isn't pinchable. In other words, you can't grab it and really pull it off the skin. The prior handpieces used to treat the stomach and the flanks rely on suction to pull the fat into a cup and then bring the temperature down close to freezing, which destroys the fat cells. On the hips, you can't do that. So they designed this new handpiece to cool down the fat to a temperature that would destroy the fat cells but doesn't rely on suction, because you can't, like I said, you can't really pinch the skin on the hips.
Gotcha.
Yeah.
So you're going to show us a little bit about how this works. You're going to actually demonstrate it on Haley here, right?
Right, yeah. She was nice enough to volunteer, and this is the perfect time of year to do this because we're in the spring. Let's get ready for summer. Now, you can see the applicator is attached, and what it's doing right now is it's bringing the temperature of the skin and the fat in her outer hip area down close to freezing. It'll do that for about an hour. An hour is long enough that it won't affect the skin. It won't damage the skin, but it will damage the fat cells, and the fat cells will be destroyed. With one treatment, we can expect about a 20 to 25% reduction in the thickness of the fat in the treated area.
So how many treatments do you usually need?
Well, someone who's like Haley in great shape and really thin and just has a little bit, probably one treatment will do. But then, you know, if you have a patient who has a little bit more in her hips, it may be 2, possibly 3 treatments.
Okay.
Yeah.
And then the results are going to last about how long?
Well, as long as you maintain your weight, the results are permanent.
Mm-hmm.
It's just like, you know, we do a lot of liposculpture too, and those results are permanent as long as you maintain your weight. But if you gained, say, 40 pounds, of course, you're going to put some more fat on in that area.
All right, let's get going on Haley, shall we?
Okay, sure, yeah.
Okay, so what are we going to do?
Okay, well, Haley's already hooked up, so I think we could
So
talk
is
to
it happening now? You don't run anything over?
No,
This is happening.
This is applied,
Okay.
and this is cooling down this entire section of skin and fat here.
Okay.
So everything in this area is going to be affected, and that's where it'll shrink down. And I think we have some before and after pictures where you can see patients who are actually treated, but we can talk to Haley and see how it feels.
Haley,
as
how
she's
does
getting
it feel?
treated.
It's a little cold, but it's not painful. It's not uncomfortable.
And why did you want to have this done? You're in awesome shape, by the way. Your legs look perfect.
It's just one of my problem areas. As much exercise as I've done, it never goes away. I wanted to avoid surgery as well, so I figured this would be the best option.
Might as well try it. Okay, very cool. Let's get to those before and after pictures that Dr. Groff was just mentioning. And we're going to be looking at, these are some patients that obviously had some areas they were concerned about. You can see on the left the before
Right,
and the
this
right
is
the
a beautiful
after.
example of a woman who had her outer hip treated. This is one treatment. You can see a substantial reduction in that outer hip with this one treatment. Now remember, there's really no downtime with this procedure. So you can literally, like Haley could go from the table, she could go straight to the gym and work out. So no downtime. So
Right.
it's a huge step forward in technology for us, but because before we had to do liposculpture in that area, and then the patient couldn't work out for a couple of weeks. And so this is really, really big.
Gotcha. Okay, what are we talking about price-wise
Well,
for this?
To treat this area, for example, would be anywhere from, I'd say, on the low end, $600 to maybe $800 per treatment.
Excellent. Anything
So-
else we should know about it? Is there anybody that's a particularly good candidate versus somebody that maybe
Sure.
if they came in, you'd say you're not a very
Right.
Good
I think
candidate for
the
this.
best candidates are candidates just like Haley, or even you or I, or anyone who's in great shape but just has a little bit maybe extra somewhere that bothers them.
Gotcha.
So, you know, patients that probably aren't good candidates, if you're, say, you know, 80, 100 pounds overweight, it's probably not the best thing for you. It's better to get your diet and exercise, get that all squared away, get yourself in the best shape you can be in, and then you fine tune the areas with the CoolSculpting.
The little leftover, just
Yeah.
that little extra that you can't get rid of.
Sure.
Dr. Groff, thank you for being here. Let's put his information up on the screen, shall we? Board certified dermatologist, Dr. Billy Groff, located on Genesee Avenue. The phone number is up on your screen. And if you'd like to learn more about CoolSculpting, CoolSculpting or Cool Smooth, you can go to our website, fox5sandiego.com, and click that Scene On tab. Let's get on over to Mr. Cool himself.
I was going to say this is cool anchoring. All right, guys, thank you.